Hello and welcome to Rise Up with Rebecca Seawright. I'm your Assembly member, Rebecca Seawright, serving the Upper East Side, Yorkville, and Roosevelt Island. Every day in America, more than 10,000 people approach retirement, and this population is growing rapidly. By the year 2030, 1 in every 5 Americans is expected to be 65 years or older. With this quickly growing demographic, there is a huge need to create better solutions, particularly in healthcare. Today, I'm pleased to welcome Cobi Blumenfeld-Gantz, who is the CEO and co-founder of Chapter. It is a tech-driven Medicare advisory organization that advises thousands of Americans nationwide who are navigating Medicare. Prior to founding Chapter, Cobi spent his career at Planeteer building data systems for the U.S. government. Cobi has received a master's degree from the University of Cambridge and completed his undergraduate at the Wharton School at the University of Pennsylvania. Cobi, you started Chapter because you saw a lack of transparency and a lack of solutions in the healthcare sector that was particularly impacting people as they approach retirement. Can you share a little bit more about your background and why you started Chapter? I hear you've had a personal connection here involving your grandfather. And I know every day we receive phone calls from seniors at our storefront office here on East York Avenue and 79th Street. People on the Upper East Side and Roosevelt Island that have questions about their Medicare, their insurance. And so if you could just explain to us why you started Chapter and your personal story.
Thank you so much for having me. I'm really excited to be here. I first encountered the challenges that Americans have navigating Medicare a few years ago when I was helping my parents sign up for Medicare. They, like most Americans, had been working, decided to officially retire, and went through the Medicare process, and there were so many deadlines, a bunch of penalties that they didn't realize they were subject to, and couldn't find anyone to trust. And as I mostly watched and helped them on the margins, because I lived in New York at the time and still do, and not with them anymore as I did when I was growing up, I guided them, but I wasn't really well positioned to really figure out what was going on with the Medicare process and how to help. So that was my foray into understanding the process a bit better. The past few years, I've focused on making the Medicare sign up and enrollment experience as seamless as it can be. As you alluded to, many people are facing this challenge every day, and it's really hard to figure out who to trust, how to go through the process, and find people who are not only well-intentioned, which I think most people are, but also have the tools and the technology to support people in the way that they require and deserve.
Right. Well, I think that you're doing a wonderful service helping our elder population navigate these important healthcare issues. America's population is aging at such a rapid pace, research shows. Over the next 2 to 3 decades, how do you anticipate this changing demographic will impact the way decisions are made across both the private and public sector?
Yeah, it's a huge both challenge and opportunity. I think if we as Americans don't do a better job of providing our older demographic with resources and tools to be self-sufficient and be independent and make good decisions, I think it prevents really fundamental and frankly existential challenges for our society and our democracy. If we think about the Medicare Trust Fund, the Social Security Trust Fund, pension plans, and the economic implications of an older population. But it's also a massive opportunity because we can provide our older population with the tools and resources to continue to thrive in this best chapter of their lives. We started a company and called it Chapter, really because we want to help people live the best chapter of their lives as they navigate retirement. And it's just such a massive opportunity. I think most both government software and private software and tools are not built with the people in mind who need these tools the most. Frankly, most engineers today are building products for people like them, people like me, people who are not approaching retirement today. And one of the really interesting opportunities has been watching the interest from people who are closer to my age. That has become a lot more. The interest in building products for an older generation has rapidly grown. I think both in the government and in the private sector, which I think is incredibly positive and will continue to help. But like many systems, it's very challenging. There are different data sets that one has to look at, different systems that one has to integrate with, and that's challenging from the public sector and the private sector. So I think we have a lot of work to do as a society to support our older population, but I'm quite optimistic about where it's going. Specifically, we see a lot of really helpful changes that CMS, the Centers for Medicare and Medicaid Services, are rolling out to their platforms at Medicare.gov. But I think there's still a long way to go, and that's where organizations like Chapter can step in and make sure that people are getting the one-to-one white glove, so to speak, support that they need as they navigate this part of their lives.
And how did you come up with the name Chapter for the company?
Yeah, as I said, it really was about helping people live the best chapter of their lives. I think the concept of life chapters is not new, it's not novel, but often we think about the early section of life when you're hopefully going to school and getting educated as chapter one, the sort of middle section of life when you're building a family and having a career as the second chapter. And both of those narratives are quite well defined in our society. But this third chapter of what we call retirement, which may or may not be a great word for it, but it is really poorly defined today. People don't have a great sense of how should they spend their time how should they spend their time, how should they spend their money, how should they leave a legacy for themselves and for their families if they're fortunate enough to. And that's really what we're trying to help people explore.
Terrific. Well, I know in our office here, we've hooked high school students up with senior citizens to help them navigate their email and their cell phone. And so I think that Chapter is doing a wonderful job in helping. Let's shift more to the Medicare specifically. Can you give me an overview of Medicare and why in some ways it's a phenomenal entitlement program, but in others, the current program needs to change in terms of more oversight and glitches that come up along the way?
Yes. So Medicare at a high level is government sponsored healthcare, primarily for Americans who are over 65, though some other Americans may be eligible due to disability and a couple other reasons. There are multiple parts to Medicare. People often hear the alphabet soup of Medicare: Parts A, Parts B, Parts C, Parts D. And these are all relevant parts, but we can go into those later. At a high level, there are different types of Medicare coverage. And what people don't tend to realize before they've really looked at it is that original Medicare, which is what people often think about when they say Medicare, only covers up to 80% of health expenses, excluding most prescriptions. And so when you think about hospital bills and large health expenses, 80% is great, but it's not nearly enough. Sometimes bills can be in the tens to hundreds of thousands of dollars. And so it's really important that Americans get that remaining 20% covered or subsidized or protected in some way. And that's where the additional programs come in. So they're at a high level, two types of supplemental Medicare plans. These are Medicare Advantage plans, which we all see lots of ads for and we see in the news a lot. It's a common topic of policy. And then there's also Medicare supplement plans, which are less well understood. At a high level, it's actually do commercial health insurance or employer-sponsored health insurance. It's a wonderful program at a high level. Obviously, it's not perfect, but there are a few key challenges people have when they actually go to sign up. And that's really what we focused on as an organization. So first is that people don't understand when they have to sign up. So many people sign up for at least Part A when they turn 65, but there's also Part B, and there are these supplemental programs. And if you get this initial sign-up window wrong, it can be actually quite challenging. The government will impose lifetime penalties on you in the form of additional premiums if you don't get your initial sign-up window correct. And unlike with Affordable Care Act based plans on a state exchange, there's not always a guaranteed right to sign up for plans without underwriting. Though in New York policy has actually been quite progressive here and quite strong, where there is guaranteed issue if people do want to switch their Medicare supplement plans typically. But there are usually over 100 plan options that people have to choose from. It's not just as simple as I'm going to sign up for parts A and B, and then I'm going to pick a plan and I'm going to be done, unfortunately. But at Chapter, we try to make that process as seamless as we can. But people have a lot of questions for good reason. People need to make sure that their doctors are covered, their prescriptions are covered, their pharmacies are in network, that it covers any healthcare needs they have when they may travel, or if they spend parts of the year in different parts of the country. These are all relevant questions that people need to look into. It's very challenging to know how to deal with it. The government at the federal level is great for generic and overview advice, but it's not great at helping people with their specific needs. In fact, they're prohibited from discussing specific plans with individuals. And similar for the state health insurance assistance programs that New York and most states have rolled out. They're wonderful programs and give very good high-level advice, but it's still very challenging for people to understand exactly which plan they should enroll in and then get the ongoing support. So it is important that people look at their plans not only annually, but every few months to make sure that their health needs haven't changed significantly, their doctor networks haven't changed, their prescriptions haven't changed. And so we help people with all of those variety of practices. But it's unfortunately not a simple system, though it is a robust one.
Right. And I know communication is key, and the devil is in the details. So people need to read their plans carefully. How would you like Medicare as a program to evolve in the years to come?
I think as a program, it's in a pretty strong spot from a health insurance perspective. There are a few specific areas where I think it can certainly improve. One is on the information transparency side. And so what I mean there is it's very challenging to know what is actually covered when you sign up for a plan. It's easy to say, yes, here's what my copay is, and here's what my deductible may be. But beyond that, it's really hard to know what services may be covered, at what rates. Do things get included in those deductibles, or do they not get included? How do my prescription prices change over time? These are very challenging questions to answer. I think the government can pass regulation that requires Medicare organizations like Chapter to do a better job and be more transparent there. The second is that I think there have been a lot of positive trends made towards covering additional prescriptions, but there are some prescriptions that are still exceedingly expensive and aren't fully covered by the Medicare program, which it would be great if they were. And then finally, I think there's a lot of information technology that needs to be improved. And this sounds very technical, it sounds very in the weeds, but these things actually do dramatically impact how people can sign up for plans. You still have to go to the Social Security Administration and then to CMS, to the Centers for Medicare and Medicaid Services, to sign up. It's not just one simple entryway. And it'd be great if there were just one entryway to help people. And of course, that's what we've built a Chapter, but it's unfortunate that we had to. I would love for us to not have to fill in these gaps that the government has created.
Right. And so how would you go about making suggestions to the Medicare program, to the federal government? Or how would you encourage our viewers today, other than contacting Chapter for help, to testify at maybe an oversight hearing on Medicare?
That would be, yes, that's an amazing way. I always encourage individuals, particularly Medicare beneficiaries, to contact their assembly members, to contact their Congress members, and to write letters to newspapers as well, because this is really a public opinion and a public policy question. And there are lots of people with very strong opinions on Medicare and the ways that it should change, which is great. I think public engagement is the only way that the program will improve. And I have seen actually Congress members take action as a result of their constituents calling in. And so I think that's a great way. the last way is actually writing directly to the Centers for Medicare and Medicaid Services. If you go on their website at medicare.gov or cms.gov, there are contact portals for people to submit requests, and they do actually read them. I am in touch with the Medicare team at CMS, and they do actually respond to people's questions, not always individually, but they do take them into account and do roll them into new regulations. So it does matter, and it is important that people contribute their voice and their opinion.
Right, that's terrific. And we always encourage people to contact their government officials and have their voices heard. So what do you see as working with the Medicare system as a whole, and what are some of the advantages of being Medicare eligible that people may not often think of right away?
Absolutely. One is that the health coverage is often more robust than people have enjoyed throughout most of their lives. So if you're on a relatively limited HMO plan through your employer or through a union or however you receive your health insurance, when you switch to Medicare, you will likely have a broader network or no network at all, depending on the type of plan you enroll in. Prescription costs also can be a lot lower, again, depending on the plan that you enroll in. And people don't realize they've actually been contributing to Medicare for most of their lives if they've been paying Medicare payroll taxes. That goes specifically to Part A in Medicare. But because people have been contributing to it for most of their lives, they actually get a lot of benefits from it once they do sign up. So I think those are a few of the benefits. And there are a lot of resources out there. I think because it is a federally run program, there are many more resources than there are for a particular plan at a commercial health insurance setup that really benefits people when they do have questions about their plans.
Great. And how does Chapter partner with organizations in the private sector as well as the public sector to support Americans as they navigate the Medicare program? And I know today having you on our show is an example of you partnering with the public sector, but tell us more about your partnerships.
We partner with both private and public organizations and individuals like you. We really try to educate consumers on their choices to steer them towards really unbiased resources that can help them navigate this. There's really good policy that the government has passed, which says that you can never be charged a different amount for your health insurance, depending on how you sign up for that health insurance. So whether you go directly to a particular insurance carrier or you go to an organization like Chapter, you'll always receive the same prices on your health insurance, which is great policy because it incentivizes individuals to get unbiased support. So when we partner with elected officials, with nonprofits, with advocacy organizations, we really try to set up these sometimes town halls, sometimes Zoom seminars, sometimes more fun activities to help people answer questions. And then with other types of organizations, often with financial advisors or healthcare providers or healthcare institutions, we try to make sure that their patients, their constituents, their clients have unbiased and comprehensive information. We find that often, for good reason, a lot of these organizations don't want to talk to Medicare advisors like us because, frankly, a lot of Medicare advisors are not unbiased and are not independent, or truly independent in the way that they should be, which is why we started the organization that we started. But I think most people do want to support their clients and constituents and patients with the best advice, and that's what we try to provide.
Terrific. That's great. And what's the best way for our constituents and viewers today to contact someone at Chapter, your organization, if they need help with anything Medicare related?
Our website is askchapter.org. So askchapter.org. So you can go there and all of our contact information is there. You can also email info@askchapter.org. So we try to be as responsive as we can. We'll usually respond to incoming emails within 2 hours, and we'll respond to any missed calls we may receive, though we're usually pretty good about picking up the phone at any point. So we're happy to help, and our services are totally free, and we're happy to help if we can.
Well, I love hearing that you pick up the phone when you're free, because I know a lot of seniors really prefer calling a telephone number and speaking to a live person. Many of them have challenges with the internet or their computers at home. So what is your phone number?
Our phone number is, let me just pull up the correct phone number to make sure that people get to the correct line. It's 855-900-CHAP, C-H-A-P. So 855-900-CHAP, that's C-H-A-P. And so we try to make it as simple as we can for people to remember and to find the line. And if you do call and you don't receive an answer immediately, we'll call back very quickly.
And the final question, is there a fee to work with Chapter?
There's no fee. We always provide our services 100% for free. And that allows us to support everyone equally. The way that we do earn revenue, because we do need to earn money as an organization, is through insurance carriers. And unlike most other Medicare advisors, we still recommend plans, even when we earn no revenue on it. So every day we help people enroll in plans on which we earn no revenue. And the reason we do that is, A, that's why we started the organization, to not be like everyone else. And B, because we think that creates trust and over time will be beneficial to individuals and to us.
And it's very transparent, your organization. So what do you see the biggest challenges with our older population in taking advantage of Chapter?
I think one big challenge is certainly understanding the distinctions between Medicare organizations. People, especially when the fall season comes around, people will see a deluge of advertisements talking about different benefits they'll get, different cost savings opportunities they'll have from different types of Medicare advisors. These are emails, these are texts, these are phone calls, these are online ads, these are TV ads, they're everywhere. And so one challenge we often have is helping people understand that we are truly independent. We are really here to help individuals. And it is frankly challenging because everyone sounds the same. Everyone says that. And it's really important that people ask their people that they're talking to, do you actually work with every single insurance carrier? And then ask a follow-up, because when I call other Medicare advisors and I ask that question, they say yes. And then I say, oh, do you actually work with these 5? And then I name the 5 and they say, oh, no, not those 5. And I say, oh, so not all of them. And so these are the types of practices that do make Medicare a really challenging space to navigate. And so one of our challenges is making sure that we are effectively communicating to beneficiaries that we can support them in the way that's best for them. But it's certainly challenging to parse out what is legitimate information from what is not.
Right. Well, that's terrific. Well, this has been an informative discussion, and I really look forward to our next episode where we'll continue the discussion with Chapter. We'll be speaking with Ari Parker, the head Medicare advisor at Chapter. And I'll just ask you again, Cobi, to repeat your website and your email address for our viewers.
Great. Our website is askchapter.org. That's ASKCHAPTER.org. And our email is info at askchapter.org. And our phone number for those who would like to give us a call is 855-900-CHAP. That's CHAP.
A good, easy phone number to remember. We encourage you to send your questions, our viewers, by email to our office at cwriter@nyassembly.gov or by calling our district office at 212-288-4607, and they'll be answered here on Rise Up. Thank you to my special guest for speaking with us today, for your outstanding leadership for our senior population on this important healthcare topic. And thank you to our viewers for tuning in with us today on Rise Up with Rebecca Seawright on the Manhattan Neighborhood Network. Thank you.